All India Radio presents Morning News. Good morning. I am Saira Mushtaba and with me is Subhadra Ramachandran. The headlines. Third phase of COVID-19 vaccination begins today. All adults to get vaccinated. Prime Minister Narendra Modi chairs a meeting of the Empowered Group, directs officials to ensure poor get benefits of free food grains without any issue. Insurance scheme for frontline healthcare workers extended for 6 months. First batch of the Russian COVID-19 vaccine, Sputnik V, to arrive in the country today. Import duty on vital diagnostic kits and reagents used in COVID-19 related diagnosis waived off by the centre for 6 months. Import of oxygen concentrators for personal use permitted by the government. Several states impose weekend lockdown to check the spike in number of COVID-19 cases. Award recognizing excellence in cinema instituted in name of Satyajit Ray. May Day being observed across the globe today, and in IPL cricket, Punjab Kings defeat Royal Challengers Bangalore by 34 runs. As the number of COVID cases is on the rise, we appeal to our listeners to take all precautions and all those above 18 years of age to get vaccinated without any hesitation. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene. And now the news. The liberalized and accelerated phase 3 of the COVID-19 vaccination drive has started today. Everyone above the age of 18 years will be administered COVID-19 vaccine in this phase. The registration process for this phase is on and over 2.66 crore people have registered on the CoWIN portal so far. The appointments for people aged 18 years and above has also opened at multiple locations. In this phase, vaccination will continue as before in central government's vaccination centres free of cost to the eligible people, including healthcare workers, frontline workers and all people above 45 years of age. Apollo Hospital and Max Hospital have confirmed their participation in the third phase of the COVID-19 vaccination drive. The 2 groups said the vaccines will be available at their limited hospitals in the country. Pre-registration on CoWIN portal or Arogya Setu is mandatory for the vaccination. A report.
During this phase, vaccine manufacturers will supply 50% of their monthly release doses to the central government and they will be free to supply the remaining 50% doses to the states as well as in the open market. The manufacturers of Covaxin and Covishield vaccines have already declared the price of vaccines that will be available to state governments and in the open market. Private hospitals will have to procure their supplies of COVID vaccines exclusively from the 50% supply earmark for other than the Government of India channel. Central government from its share will allocate vaccines to states and UTs based on the criteria of the extent of infection and the speed of administration. All vaccination will be the part of National Vaccination Program and mandated to follow all protocols such as being captured on the CoWIN platform. Divakar, AR News, Delhi.
Vaccination of people in the age group of 18 to 44 years begins today. In Maharashtra, Chief Minister Uddhav Thackeray appealed to the people not to overcrowd vaccination centres as vaccines are in limited stock. More from our correspondent.
Chief Minister Uddhav Thackeray appealed to the people to go and get vaccinated on the date and time issued by CoWIN app. The state government is ready to accept the responsibility of vaccinating the citizens in age group of 18 to 44 years, but due to limited availability of vaccine, the citizens should not rush to the vaccination center. There are 6 crore citizens in this age group in the state who need 12 crore vaccines even if they are given 2 doses each. Booking slots for these vaccination centers were made available late night, but only limited booking was available. The Chief Minister said that he had written a letter to the Prime Minister asking him to create a separate app for each state or let the state create their own app and allow it to be added to the CoWIN app. Bhavna Gokhale, AIR News, Mumbai.
The Gujarat government will launch the vaccination drive for people above the age of 18 years in 10 districts from today. According to the official sources, Chief Minister Vijay Rupani will launch the vaccination drive on the occasion of Gujarat Foundation Day today. We have more from our Ahmedabad correspondent.
Chief Minister Vijay Rupani will launch the free vaccination drive against COVID-19 for 18-plus age group from today on the occasion of the Foundation Day of Gujarat. Official sources said that initially the drive will be launched in 10 districts with more infections. The people of the concerned age group have been asked to register themselves through an online portal as there is no provision for spot registration. The 10 districts in which the vaccination drive will be launched are Ahmedabad, Surat, Vadodara, Rajkot, Bhavnagar, Jamnagar, Kutch, Mehsana, Bharuch and Gandhinagar. Gujarat government has already ordered 2 crore 50 lakh doses of vaccines, out of which 3 lakh doses reached Ahmedabad by air last night. State government has asked the people to turn up for the vaccination only after receiving the SMS about their appointment. Yogesh Pandya, AR News, Ahmedabad.
The Odisha government will conduct a trial vaccination for people in the age group of 18 to 44 years today. According to the information received from the State Health and Family Welfare Department, only a token number of beneficiaries would be administered Covaxin shots in the capital Bhubaneswar during the trial. The third phase of vaccination will begin within the limits of Bhubaneswar Municipal Corporation from 3rd of May. A report.
With the state's Covaxin stock replenished with 1.5 lakh doses as part of the state's own procurement of vaccines last night, the third phase of COVID-19 vaccination can at least kick-start in capital Bhubaneswar from coming Monday. Today and tomorrow being weekend shutdown in all the urban centers of the state. Rolling out the vaccination process in the rest of the state, however, is incumbent upon the receipt of Covishield vaccine, for which the state has already placed an order for 3.77 crore doses before the Serum Institute of India. While Covaxin, for which the state has ordered for 10.34 lakh doses before the Bharat Biotech, is used only within the limits of the municipal area of Bhubaneswar. Meanwhile, COVID-19 active case load of the state has further mounted beyond 61,000, with a high of 8,681 people having tested positive during the last 24 hours. Girish Chandradas, AIR News, Bhubaneswar.
In Uttar Pradesh, the first phase of vaccination for people in the age group of 18 to 44 years will start today in 7 districts that have more than 9,000 active COVID-19 cases. It will be extended to other cities later. Additional Chief Secretary, Health, Amit Mohan Prasad, informed yesterday, COVID-19 vaccination drive will start in Lucknow, Kanpur, Allahabad, Varanasi, Gorakhpur, Meerut and Bareilly. The vaccination drive for people above 45 years of age will continue as usual at 6,000 vaccine centers across the state. The first batch of the Russian COVID-19 vaccine, Sputnik V, is scheduled to arrive in India today. The Russian vaccine's arrival is expected to boost India's efforts in ramping up its capacity to vaccinate more people.
Prime Minister Narendra Modi has directed officials of the central government to work in close coordination with the states to ensure that the poor get the benefits of free food grains without any issues. He virtually chaired a meeting to review the functioning of different empowered groups yesterday. The empowered group on economic and welfare measures made a presentation to the Prime Minister on the steps taken, such as extension of PM Garib Kalyan Anna Yojana. It was discussed that portability enabled due to One Nation, One Ration Card initiative has helped benefit more people. The insurance scheme for frontline health workers has been extended for another 6 months. Prime Minister said that steps should be taken to expedite the settlement of pending insurance claims so that the dependents of the deceased are able to avail of benefits in time. The empowered group on issues relating to facilitating supply chain and logistics management gave a presentation on various advisories relating to measures to be taken to contain the pandemic. The Prime Minister instructed officials to plan holistically to ensure seamless movement of goods so that supply chain disruptions are avoided. The empowered group on coordinating with private sectors, NGOs and international organizations briefs the Prime Minister on how the government is working in active partnership with them. The Prime Minister had asked the officials to explore how volunteers from the civil society can be utilized to lessen the pressure on the healthcare sector by invoking them in non-specialized tasks. It was discussed that NGOs could help to establish and maintain lines of communication between the patients, their dependents, and the healthcare personnel. The Prime Minister said that the ex-servicemen could be encouraged to handle call centers for communicating with people under home quarantine.
The centre has waived off import duty on vital diagnostic kits and reagents used in COVID-19 related diagnosis for the next 6 months. The decision has been taken to supplement testing efforts. The exemption has been given till 31st of October this year. Amidst the ongoing pandemic, the government provided relief to the people by permitting import of oxygen concentrators for personal use through post, courier or e-commerce portals under gift category. The permission has been given till 31st of July this year. The Directorate General of Foreign Trade has issued a notification in this regard.
Civil Aviation Ministry has given permission to Telangana government to use drone for experimental delivery of COVID-19 vaccines. The permission exemption is valid for a period of 1 year or until further orders. Earlier this month, similar permission was granted to the Indian Council of Medical Research for conducting feasibility study of COVID-19 vaccine delivery using drones in collaboration with IIT Kanpur. The grant of these permissions is intended to achieve the dual objectives of faster vaccine delivery and improved healthcare access by ensuring primary healthcare delivery at the citizen's doorstep. The ministry said this will ensure access to healthcare to the last mile and limiting human exposure to COVID-prone areas through aerial delivery. Railway has waived off charges for COVID-19 testing and food supply during COVID-related hospitalization for non-railway patients. Railway Ministry said government is following whole-of-government approach where all the ministries and departments are working as one to prevent and fight the spread of COVID-19 infection. The ministry said Railways has been at the forefront of fighting the COVID, and waiving off key medical charges is a step towards making the healthcare accessible for all.
AIIMS Director Randeep Guleria has stressed that misuse of drugs must be avoided to effectively deal with cases of COVID-19. In a media briefing in New Delhi yesterday, Dr. Guleria suggested measures for the treatment of patients with mild asymptomatic diseases in home isolation. He said if the fever is not controlled with the maximum doses of paracetamol 4 times a day, then it is advised to consult a physician. He also advised to do warm water gargles or inhale steam twice a day.
अगर आपका बुखार जो है वो पैरासीटामोल जो हम कहते हैं कि आप 650 मिलीग्राम दिन में 4 दफा ले सकते हैं, उससे कम नहीं हो रहा है तो अपने डॉक्टर से संपर्क करें और आप दूसरी कोई दवाई जिससे बुखार कम हो सकता है, जिनको हम कहते हैं नॉन स्टेरॉइड एंटी इन्फ्लेमेटरी ड्रग जैसे नेप्रोक्सोन है या इब्यूजेसिक है, उस टाइप की दवाई भी ले सकते हो जिससे आपका बुखार कम हो जाए, क्योंकि कई मरीज ऐसे हैं तो ये कहते हैं कि पैरासीटामोल से उनका बुखार नीचे नहीं आ रहा, अभी भी 101, 102 पे है, तो तब अपने डॉक्टर से संपर्क करके दवाई थोड़ी चेंज कर सकते हैं। हम ये भी एडवाइस करते हैं कि आइवरमेक्टिन जो एक दवाई है वो रोज एक गोली ले सकते हैं 3 से 5 दिन के लिए। इस दवाई की रिकमेंडेशन बेस्ड ऑन डिस्कशन जो नेशनल टास्क फोर्स और जॉइंट मॉनिटरिंग ग्रुप की मीटिंग में हुआ था, जिन्होंने सारा डेटा एवेल्युएट करके ये पाया था कि शायद इस दवाई से थोड़ा बहुत फायदा हो सकता है और इसलिए ये होम आइसोलेशन की गाइडलाइंस में डाली गई हैं।
You are listening to the morning news on All India Radio. A reminder of the headlines before we move on. Third phase of COVID-19 vaccination begins today. All adults to get vaccinated. Prime Minister Narendra Modi chairs a meeting of the Empowered Group, directs officials to ensure poor gets benefits of free food grains without any issue. Insurance scheme for frontline healthcare workers extended for 6 months. First batch of the Russian COVID-19 vaccine, Sputnik V, to arrive in the country today. Import duty on vital diagnostic kits and reagents used in COVID-19 related diagnosis waived off by the Centre for 6 months. Import of oxygen concentrators for personal use permitted by the government. Several states impose weekend lockdown to check the spike in number of COVID-19 cases. Award recognizing the excellence in cinema instituted in name of Satyajit Ray. May Day being observed across the globe today, and in IPL cricket, Punjab Kings defeat Royal Challengers Bangalore by 34 runs. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts. चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो खुद से वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
Welcome back. You're listening to the morning news. In Gujarat, at least 14 persons, including COVID patients and 2 staff members, died after a fire broke out at a hospital in Bharuch early this morning. There were about 50 other patients at the 4-storied welfare hospital when the fire broke out in the COVID-19 ward around 1 a.m. According to sources, many other patients have been rescued from the hospital by locals. The fire was controlled within a few hours and around 50 patients were rescued by the locals. They have been shifted to nearby hospitals. The COVID-19 designated hospital is situated on the Bharuch-Jambusar highway and is being run by a trust. The cause of the fire is yet to be ascertained. In the national capital, Delhi, a total of 27,047 new confirmed cases of coronavirus infection were reported in the last 24 hours, taking the total number of cases to over 11,49,000. The Delhi government said over 10 lakh people affected with COVID-19 have been cured so far. In the last 24 hours, 25,288 people recovered and 375 deaths were reported in the city. The death toll so far in the national capital stood at 16,147. Presently, the total number of active cases of COVID-19 in Delhi is 99,361.
In Maharashtra, 69,710 COVID-19 patients have recovered yesterday, while 62,919 new cases were found on the same day. 828 COVID deaths were reported and the fatality rate is 1.5%. The state has now 6,62,640 active cases. Pune has more than 1 lakh active cases, the highest in the state, followed by Nagpur with 78,614 active cases. Mumbai has 65,670 and Thane has 50,474 active cases. The Bihar government has taken the decision to give a government job to one family member of those government officials who died due to COVID complications in the state. This decision was taken at the cabinet meeting, which was chaired by the Chief Minister Nitish Kumar. As per the decision, if the doctor or health worker dies due to COVID-19 infection picked up when on duty, the salaries due for the remaining period of their service will be paid to the surviving family in the form of special family pension. In view of the spike in COVID cases, the state government has cancelled the leave of all health officials till May 31. Fresh cases of COVID-19 continue to rise rapidly. A record number of 15,853 fresh cases were reported in the state yesterday. This is the highest number of cases reported on a single day. 152 deaths were also reported.
The Assam government has extended the night curfew across the state from 8 p.m. to 5 a.m. till 7th of May. The order issued by the Chief Secretary imposed a complete ban on movement of individuals from 8 p.m. to 5 a.m. during this period. However, movement of people related to essential services, medical staff and patients is exempted from the night curfew, as well as those who are going for COVID-19 vaccination. Journalists with valid identity cards are also exempted from the purview of the night curfew. In the Union Territory of Jammu and Kashmir, all 20 districts are under complete lockdown since last evening. The strict restrictions will continue till 7 a.m. on Monday. The vaccination drive for persons in the age group of 18 to 44 years has been deferred at least till the 15th of May. Financial Commissioner, Health and Medical Education Department, Atal Dhullo, said that the drive would start soon after the vaccine supplies are received in the Union Territory. 3,532 new COVID cases and 30 fatalities were reported in Jammu and Kashmir in the last 24 hours. More from our Srinagar correspondent.
Advisor to Lieutenant Governor Basir Ahmad Khan, while addressing a press conference in Srinagar yesterday, said that there is no dearth of oxygen, COVID vaccines and remdesivir in Jammu and Kashmir. He said that the Union Territory is one of the best places which is effectively managing the prevailing unprecedented COVID scenario. He said that 20-ton oxygen is available at present, which is quite sufficient to meet the demand. Divisional Commissioner Kashmir P.K. Pole, present on the occasion, said that remdesivir is available in sufficient quantities at Sikkim Sora, SMHS and other hospitals in Kashmir Valley. He said that 111 ventilator beds are presently available in Kashmir and the number of oxygen connected bed capacity is being increased from 1,600 to 2,500 beds in the next 5 days. Sunil Kaul, AIR News, Srinagar.
Several state governments have imposed weekend lockdowns to check the spike in number of COVID-19 cases. Haryana government has imposed weekend lockdown in the following 9 districts of the state: Panchkula, Gurugram, Faridabad, Sonipat, Rohtak, Karnal, Hisar, Sirsa and Fatehabad, considering the need of taking effective measures to prevent the spread of coronavirus. As per the orders issued by the Chief Secretary, the weekend lockdown came into force from 10 p.m. yesterday till 5 a.m. on May the 3rd, that's Monday. He said that the movement of persons tasked with law and order, emergencies and municipal services and government officers tasked with COVID-19 related duties will be allowed on production of identity cards. Furthermore, there shall be no curbs on those engaged in manufacture of essential goods. There shall be no curbs on movement of essential and non-essential goods. The 3-day corona curfew began in Uttar Pradesh last evening. It will continue till 7 a.m. on Tuesday. Ruling out a complete lockdown for now, Punjab Chief Minister Captain Amrinder Singh has directed the DCs of the 6 worst affected districts to further tighten the micro-containment strategy and ensure 100% testing. The Chief Minister was chairing a virtual emergency meeting yesterday to review the COVID situation in the 6 worst hit districts of Ludhiana, SAS Nagar, Mohali, Jalandhar, Bathinda, Patiala and Amritsar. Captain Amrinder said that lockdown is not a solution as it will lead to exodus of labourers and force them to go to states with even lesser medical facilities. He directed the district administrations to strictly enforce all restrictions and to stop dine-in facilities in all high positivity areas. He also stressed on COVID testing of staff in restaurants by the health department. Urging the industry to set up their own COVID treatment centres and makeshift hospitals to treat their own labourers suffering from mild and moderate infection, he stressed on teamwork to fight the battle against COVID-19.
In view of the spike in COVID-19 cases throughout the state, the government of West Bengal has imposed a series of restrictions to contain the spread of the pandemic with immediate effect. Shopping complexes, malls, beauty parlours, cinema halls, restaurants, sports complexes, gyms, spas and swimming pools shall remain closed until further orders. All social, cultural, academic and entertainment-related gatherings will remain prohibited. Markets, bazaar or haat will remain open from 7 a.m. till 10 a.m. in the morning and from 3 p.m. to 5 p.m. in the afternoon. However, the restrictions will not be applicable for essential services like medical shops, medical equipment shops, groceries, etc. The government has instituted an award to recognize excellence in cinema in the name of Satyajit Ray. Satyajit Ray Lifetime Achievement Award will be given from this year at the International Film Festival of India. The award consists of a cash prize of 10 lakh rupees, a certificate, shawl, along with a silver peacock medal and a scroll. The Ministry of Information and Broadcasting has announced to organize year-long centenary celebrations of Satyajit Ray across India and abroad. Satyajit Ray was a renowned filmmaker, writer, illustrator, graphic designer and music composer. As part of the celebrations, the media units of Ministry of Information and Broadcasting, including Directorate of Film Festivals, Films Division, NFDC, NFAI and Satyajit Ray Film and Television Institute are planning a series of activities. Other ministries and departments, including the Ministry of External Affairs and the Ministry of Culture, will also take part in this event.
Today is International Labour Day. The day is celebrated to honour the contribution of workers across the world. It is also known as May Day. The day aims at paying tributes to workers' sacrifices in achieving economic and social rights all over the world. On the occasion, Director General of International Labour Organization, Guy Ryder, has called on workers, employers, governments, international organizations and all who are committed to building back better to join forces to bring in a world of work with justice and dignity for all. The nation is commemorating the 400th Prakash Purab of Sri Guru Tegh Bahadur Ji, the 9th Sikh Guru, today. Born in Amritsar, Punjab in 1621, Sri Guru Tegh Bahadur Ji was the youngest son of Guru Har Gobind Sahib, the 6th Sikh Guru. Considered a principled and fearless warrior, he was a spiritual scholar and poet whose 115 hymns are included in Sri Guru Granth Sahib Ji. On the special occasion, Prime Minister Narendra Modi in a tweet said that he bows to Sri Guru Tegh Bahadur Ji, who is widely respected globally for his courage and efforts to serve the downtrodden. Prime Minister Narendra Modi visited Gurudwara Ganj Sahib in Delhi this morning and offered prayers on the 400th Prakash Purab of Guru Tegh Bahadur. He visited the Gurudwara without any security route and special security arrangements there.
And now news from the world of sports.
Skipper KL Rahul scored a combative 91 while Harpreet Brar accounted for three key batsmen as Punjab Kings thumped Royal Challengers Bangalore by 34 runs in an IPL match at Ahmedabad's Narendra Modi Stadium last night. Put into bat, Punjab were in a spot of bother at one stage, but Rahul's onslaught along with Chris Gale's smashing 46 off 24 balls added 80 runs in just 44 balls. The win took Punjab to 5th place with 6 points, behind Mumbai Indians also at 6. A resurgent Mumbai Indians will take on Chennai Super Kings at Delhi's Arun Jaitley Stadium tonight. Meanwhile, Indian Cricket Board BCCI has hinted that this year's T20 World Cup could be moved to the United Arab Emirates if the COVID-19 crisis does not subside in India. In Zimbabwe, a superb 4th Test century by Pakistani opener Fawad Alam and Imran Butt's career best 91 helped visitors take an imposing 198-run lead at the end of Day 2 of the first Test at the Harare Sports Club. Sri Lanka would be looking at a score in excess of 500 runs early on Day 3 after they reached 469 for 6 on the second day of the second Test against Bangladesh at the Pallikal International Cricket Stadium yesterday. In the other sports news, in Madrid Open, world number 2 Naomi Osaka recovered from a slow start to defeat qualifier Misaki Doi 7-5, 6-2 in the first round yesterday. Osaka will now take on Australian Open semi-finalist Karolina Muchova of Czech Republic. Bruno Fernandes and Edison Cavani scored a brace each as Manchester United came from behind with 5 second-half goals to thrash Roma 6-2 in the first leg of their Europa League semi-final tie. Sports Desk, AIR News, Delhi.
And now let's take a look at the weather forecast. National capital Delhi will have a partly cloudy sky with possibility of thunder lightning. Minimum temperature was 24 degrees Celsius and maximum may go up to 39 degrees. Mumbai will also have a partly cloudy sky with possibility of thunder lightning. The minimum temperature was 26 degrees and maximum will be around 35 degrees Celsius. Chennai will see a partly cloudy sky. Temperature will hover between 28 and 37 degrees Celsius. Kolkata will have a partly cloudy sky as well with possibility of moderate rain. The minimum temperature was 28 degrees and maximum will be around 37 degrees Celsius. Jammu will have a mainly clear sky becoming partly cloudy towards the afternoon or evening. The minimum temperature was recorded at 23 degrees and maximum will be around 39 degrees Celsius. Srinagar will have a mainly clear sky becoming partly cloudy towards the afternoon or evening. Leh will have a partly cloudy sky with temperatures ranging between 3 and 17 degrees Celsius, while Gilgit will have a mainly clear sky. Temperature will hover between 10 and 33 degrees Celsius. Muzaffarabad will have a mainly clear sky becoming partly cloudy towards the afternoon or evening. The temperature will hover between 15 and 37 degrees Celsius.
And now an overview of today's newspapers. Rolling out of the third phase of vaccine from today is covered widely by dailies today. The Economic Times headlines, SC wants centre to ensure jabs for all at low prices. The Pioneer headlines, UP Gujarat to keep May 1 jab date. In order to study the virus, scientists urge PM to release COVID data, reports the Financial Express. The Statesman writes, Modi urges ministers to take pulse of local situations, get feedback. The paper also carries a picture of the first consignment from the U.S. landing in India with the caption, U.S. gifts 423 oxygen cylinders with regulators and other medical supplies. Papers have also covered the sad demise of jurist Soli Sarabji. The Hindustan Times says, adieu Soli Sarabji, jurist, legal luminary and jazz aficionado. And finally, the Economic Times reports, India Inc. steps up with COVID care centres for staff.
And now before we end the bulletin, the headlines once again. Third phase of COVID-19 vaccination begins today. All adults to get vaccinated. Prime Minister Modi chairs a meeting of the Empowered Group, directs officials to ensure poor get benefits of free food grains without any issue. Insurance scheme for frontline healthcare workers extended for 6 months. First batch of the Russian COVID-19 vaccine, Sputnik V, to arrive in the country today. Import duty on vital diagnostic kits and reagents used in COVID-19 related diagnosis waived off by the centre for 6 months. Import of oxygen concentrators for personal use permitted by the government. Several states impose weekend lockdown to check the spike in number of COVID-19 cases. Award recognizing excellence in cinema instituted in name of Satyajit Ray, and May Day being observed across the globe today. And with that, we end the morning news. Have a great day.